Did you know your baby can hear you sing at one point of your pregnancy? Or that pregnancy takes an average of 40 weeks before delivery? Well, now you know. There are many other things you need to know about your pregnancy and your baby, and this video will be bringing it right to you. While every week of your pregnancy is important, there are some weeks that may stand out because of the activities and growth that happen during them. Keep watching to know what happens in selected weeks of your pregnancy to ensure your baby is safe till delivery, shall we? Week 7, a beating heart. Ever heard the steady, consistent sound of your own pulse, or better still, your heartbeat? Well, by week 7, which is still in the first trimester, your baby's heart begins to develop, and a slight pulse can be felt, although it is very imperceptible. Now, there is no definite protrusion at the time, but you will be able to hear your baby's heartbeat, even though your baby is not totally developed at the time. This totally figures because there is no human without a heartbeat. A heart would surely develop before your baby develops. Apart from the beating heart, your baby has also developed its placenta and amniotic sac by this week. The placenta attaches itself to your uterine wall to get nutrients and oxygen from your bloodstream. You will be feeding another life, so you need to stock up on healthy meals to get more nutrients. The brain is also developing rapidly, which results in the head getting bigger than the rest of the body. The inner ears start to develop at this time, but the outer ears do not play the obvious for quite a while. Week 12, starting ultrasound, toe curling and sucking sounds. By this week, your baby's hands and feet are developing, and you might begin to feel some movement in your stomach area, although this is very unlikely. But here is a fun fact. Babies' hands develop faster than their feet, which means you get to see hands defined faster than feet. The hands and feet appear as webs of skin, though. They are not as defined as you think. This is also the time when you can go for a standard screening test, where you have to do a blood test and ultrasound to see how your baby is doing and how much growth is left. By this time, your baby has achieved more growth than you can imagine. The kidneys are functional, and the intestines are even taking shape. If this is your first baby, you're probably anxious to get your first scan. How did you feel after your first scan, if you've done one? Ecstatic, right? Let us know in the comment section. In week 12, you can also do tests to check for any deformations. At this time, your baby is usually about 2 inches long and can weigh about half an ounce, meaning you are not feeling so many changes yet. Week 13. The second trimester. Week 13 marks the beginning of your second trimester, which usually also ends by week 27. Interestingly, by week 13, all limbs are fully formed, and you can see a hint of your baby's face. Your baby can swim more vigorously at this time, and its organs are steadily growing and developing as fast as possible. This week is usually characterized by fewer episodes of frustrating morning sickness and an increase in energy. One upside or downside, depending on how you see it, of this time is that you might have an increased sex drive. This is simply due to increased pregnancy hormone production and blood flow to the pelvic area. If you are looking to have sex when you are pregnant, know that it is perfectly safe unless you have been advised otherwise by your doctor or midwife. At this stage, your baby bump will gradually become visible, and you will begin to gain more weight, which is a good thing. However, as the popular going says, too much of anything is bad. Gaining too much weight is not good for you and your baby. It can be a sign of something called gestational diabetes and can be avoided by regular, albeit slight, exercise and a healthy diet. Week 16 to 25. Kicking and feeling. Weeks 16 to 25 characterize the beginning of a lot of baby movements, so you will need to be ready for it. Doctors officially call it the quickening period. It's one of the most exciting periods for mothers, especially first-time mums. Here, all the peace and quiet officially comes to an end. Your baby will begin moving very often to let you know that they are still very much alive. These movements may initially feel like butterflies or a gentle flutter, so watch out. If you're a first-time mom, you may mistake your baby's movement for gas bubbles or hunger pangs. But not to worry, as your baby grows bigger and pregnancy progresses, you'll be able to pick these kicks or movements without a second thought. By the 24th and 25th week, you may even begin to see distinct parts like the foot, hand, or elbow. Amazing, right? Do you know what's crazier? Each baby has a specific pattern of kicks or movement, and you can tell after a while. Also, these movements are harmless and not painful, so you have nothing to worry about. Week 28, the third trimester begins. Week 28 is the common week that marks the beginning of the third trimester, or the business end of your pregnancy. At this stage, you are likely to get more worried, experience back pain, and have breathing and sleeping difficulties. This is only because your baby is now far gone in development and is getting bigger with every passing day. Your baby will weigh in around the 1 kilogram mark and will have a more proportionate appearance, quite unlike the second trimester, where the head is more defined than the rest of the body. All of your baby's body parts are now very visible and can be viewed through scans. A heartbeat can also be heard when a digital or manual fetoscope, a stethoscope for your baby, is placed on your distended belly. Your baby also begins to put on more weight. Week 36, term pregnancy. You must have heard of the term pregnancy and wondering what it means. Well, what it simply means is that your baby is fully formed and can safely be delivered. So, what are the characteristics to be found in your baby at week 36? For starters, your baby's lungs are close to complete development. Most times, they are even fully developed and are ready to take in their first oxygen intake. The digestive system is also ready to take in food. Completely opposite to taking meals through the placenta while in the womb, your baby is also big enough, which makes little to no space available in your womb. For you, you might start experiencing contractions, and your baby will resort to kicking and stretching. The contractions are actually normal, as your uterus is preparing for the contractions and tightenings of labor. Your baby's head is most likely facing towards your pelvis, ready to come out and relieve you of the stress of the past 9 months. If you are not sure of your baby's position, you should consult your doctor. Remember that every stage or week is important, so you need to be as careful each week. Also, labor can start anytime now, so get those baby bags ready. Week 40, ready to be born. Now your baby is arriving in plus or minus days of this time, not weeks. The fine hair or lanugo covering our baby in the womb is close to completely gone. If your baby has some of it at birth, be at rest. It is a normal occurrence. It is important that you are ready for labor and should prepare accordingly. Ways to prepare include having your mobile phone around you at all times to call the hospital ahead. You can also check into the hospital before time if you are experiencing contractions frequently. Note that this is perfectly normal and should not be seen as an indicator of a pregnancy about to go wrong. It is pretty unclear what exactly induces labor. Still, the closest research has come to putting a name on it is that it is a combination of physical, emotional, and hormonal factors with not just the mother, but also the baby. Pregnancies usually take a specific length of time, usually around 40 weeks. This is so because every week comes with a specific event. For instance, the baby inside you grows its limbs only at week 13. So, when you get the good news that a new life is budding in you, you should be ready to know what will happen each week, so you are not surprised by a kick in week 16 or your water breaking around the 40th week of your pregnancy. This is why the pregnancy stage is divided into 3 stages or trimesters. Weeks 1 to 12 are the first trimester, weeks 13 to 27 are the second trimester, and weeks 29 to week 40 are the third trimester. Every development period also signifies a time when your baby should be protected from exposure that could result in deformations. Now you know why you need to be in the know. Once again, every week of pregnancy is important, so you should do due diligence to ensure that no complications arise during the pregnancy of your budding, adorable baby. Being pregnant is a beautiful process, one that comes with so much responsibility and sacrifice. It is time to clear your wardrobe of trousers and shorts and get some gowns and long summer dresses. Don't forget to like the video and hit the subscribe button. Be the first to learn all you need about this amazing journey called pregnancy. Now check out these videos.